Many men are told their blood tests are normal, even while their body is clearly not functioning the way it used to. This disconnect is one of the most confusing experiences in metabolic health. Energy is lower, fat gain is easier, recovery is slower. Yet routine lab results come back within reference ranges. This creates doubt. If the tests are normal, then nothing must be wrong. But this assumption misunderstands how metabolic regulation actually works. Most standard blood tests are designed to detect disease, not early dysfunction. They identify states where regulation has already failed, not stages where the body is quietly compensating. Blood tests measure static values. Metabolism is a dynamic system. A fasting glucose value, for example, shows what blood sugar looks like at a single moment in time. It does not reveal how much insulin was required to keep it there. It does not show how efficiently energy moves into and out of tissues across the day, or how quickly the system adapts to changing demands. The same principle applies to cholesterol and triglycerides. These values reflect circulating levels at rest. They do not capture how the body handles energy after meals, during stress, after physical effort, or during recovery. In early metabolic dysfunction, the body works harder to maintain normal-looking numbers. Insulin secretion increases. Storage signaling becomes stronger. Energy release becomes more restricted. From the outside, balance appears preserved. Internally, regulation is under increasing strain. This is why insulin resistance can develop long before glucose levels rise. The body compensates by producing more insulin, maintaining normal glucose at the cost of flexibility and energy availability. As long as compensation holds, blood markers remain reassuring. But compensation is not free. Every layer of compensation narrows the system's margin for error. Energy access becomes less reliable. Hunger signals become louder and less precise. Small disruptions begin to have larger effects. Recovery takes longer than it used to. These changes often appear first as lived experience, not lab abnormalities. Standard blood tests do not capture this loss of flexibility. Another limitation of routine testing is that it assumes stability. Blood tests are typically performed under controlled conditions, fasting, rested, one moment in time. This environment minimizes stress on the system. But metabolic problems often appear under demand. They show up when meals are delayed, when sleep is shortened, when stress is prolonged, or when physical effort is required. These are the moments that reveal whether regulation is resilient or strained. A system that appears normal at rest may struggle under pressure. This is why many men report that they feel worst not in the morning during a fasted blood draw, but later in the day. Energy fades, focus drops, hunger intensifies, recovery slows. None of this appears in standard lab results. Metabolic health is less about resting values and more about how the system responds to change, how quickly it adapts, how smoothly it returns to baseline. Routine blood tests are not designed to measure adaptability. They measure containment. As long as the body can contain values within range, tests appear normal, even as regulation becomes increasingly costly. This gap between containment and resilience explains why symptoms often precede diagnosis by years. They also do not capture variability. A single fasting measurement cannot show whether energy remains available between meals, whether stress responses resolve efficiently, or whether the body recovers predictably after effort. These dynamic responses define metabolic health, yet they remain invisible to routine testing. This is why many men feel dismissed when symptoms are present, but labs are normal. The tests are answering a different question. They are asking whether disease is present. The body is asking whether regulation is sustainable. Over time, compensation becomes harder to maintain. Eventually, laboratory values begin to drift. Glucose rises, triglycerides increase, fat gain accelerates, fatigue becomes persistent. At that point, dysfunction becomes visible on paper. But by then, the system has been adapting quietly for years. Understanding this gap reframes frustration. Normal labs do not mean nothing is happening. They mean the body is still compensating. Symptoms often appear before markers change. This does not mean blood tests are useless. It means they must be interpreted in context. Metabolic health is not defined by a single number. It is defined by responsiveness, resilience, and flexibility over time. In the next video, I will explain why stress and sleep have such a powerful effect on belly fat, often more than calorie intake alone. On this channel, I explain metabolism using medical science. This video is for educational purposes only. This is not medical advice. Always consult your physician.